yesterday was the last day of Chinese New Year. However, it's not too late if you're contemplating to have a dragon baby. So especially for those of you who already changed your mind about having babies and underwent vasectomy, and now thinking about a reversal of vasectomy in order to produce another offspring. So exactly what's the difference between the woman and men's sterilization? In women, the actual connection of the ligated fallopian tube is impossible. However, in the men, when you undergo vasectomy, the actual rejoining of this is completely possible, and a procedure called reversal of vasectomy or vasovasostomy. So how exactly is done? Well, it's not as simple as the vasectomy itself, because vasectomy is done under local anesthesia, but reversal is done under general anesthesia. And during this time, microscope is being utilized so that the reversal can be done with intricacy. The success rate of reversal is very important because the earlier you change your mind, the higher the success rate. And for example, if you change your mind within 10 years, the success rate of the patency of the sperm going through that reversal site is about 90%, but beyond 10 years, that can drop to about 60%. However, success rate doesn't translate to having a baby because there is obviously other consideration to take into account. For example, there's such thing called anti-sperm antibodies. So when there's a lot of manipulation of the testicle, the sperm testicular barrier, the sperm blood barrier is actually being compromised, and the body will build up autoimmune system that will attack the sperm itself. So anti-sperms antibodies may not be so helpful. So under that circumstance, the actual pregnancy rate is only half. For example, within 10 years of doing a reversal, the patency rate is about 90%, but the pregnancy rate is only about 50%. In order to overcome this, there is such thing called artificial reproductive technology, which is test tube baby. So what we can do as clinician is that we go and look for one healthy sperm and create a healthy baby for you. Voila, you don't even need to undergo the reversal of vasectomy. So for the next month, we're going to focus a little bit differently on different type of medication that helps with erection. Yes, the blue pills. Stay tuned for next week's Putting Dr. G on the Spot.